Coming up this half hour, we're talking health headlines with Dr. Lauren Streicher, including progress for at-home screening for cancer.
And joining us now, professor at Northwestern University Medical School and WGN Morning News medical contributor, Dr. Lauren Streicher. Good to see you this morning.
Good morning.
So first off, we're going to talk about an at-home test for HPV.
This is really important, big news, because it used to be before 1960, when Pap tests became standard, cervical cancer was the #1 cause of death in young women, and of course that all changed. But now we're heading into a period of time where cervical cancer rates are actually going up. And there are a lot of reasons for that, but one of the reasons is people aren't going to the gynecologist. They're not getting their Pap test done, and I get that. And so there has been a lot of movement to say, okay, how can we get this done at home? You know, it's not just poop in a box for colon cancer screening. It's like, let's expand this to other things. So there's been a lot of work going on looking specifically, of course, the HPV virus is the virus that causes cervical cancer. And you can do a vaginal swab at home and send it back, and it's quite accurate. So the question is number one, are people going to actually do this? And number two, is it cost effective? So a study just came out that they had 20,000 women. They were all way overdue for their Pap tests. And half of them got a notice that said, please go to your gynecologist and get a Pap test. And, you know, here's a link for an appointment. And the other half got the at-home test. Well, you can guess where this is going. The people with the at-home test all sent it back. They found a lot of abnormalities, and they followed up. So not only were they willing to do it and that it was cost effective, but it works. Wow. So I think we're going to see a lot more of this. And I'm all for it, of course, because we need to get these women screened. Of course, it's not the same as going to the gynecologist. There are other things that happen at the gynecologist, but still, I think this is something that is definitely on the horizon.
All right, how about lactation cookies? Do they really work?
Yeah, how about lactation cookies? I mean, I'm all for eating cookies. I mean, cookies are great, but this is a thing. This has been all over social media, of course, that if you eat these cookies that have very specific ingredients, oatmeal, brewer's yeast, flaxseed, that it is going to increase milk production. And it's not just about making these cookies. There are these companies, there's tons of companies that are selling these cookies, saying, eat these if you are breastfeeding. Well, a study finally came out, and I think you know where this one's going, in the don't be duped category. Basically, they took a couple hundred women who were breastfeeding, and they followed them for a month. Half of them got lactation cookies. The other half got cookies that tasted and looked and just the same, but without those ingredients. And of course, there was absolutely no difference between the two.
How can they market them that way then?
Because this isn't an FDA thing. I actually just did a podcast on that, about this whole idea of how you can put things out there and make these claims. And you know, the FDA is not in on this. They're in on drugs. So you could say that those same cookies are going to decrease wrinkles and help you lose 10 pounds, and no one's going to stop you from doing that. So yeah, of course these women are buying these cookies because they're thinking, why not? Maybe it will help. And in fact, it doesn't help. And you know, and I actually didn't do a price compare, but I suspect that these cookies are more expensive than just buying delicious cookies. And you can make your own. Bon Appetit has a recipe, but to their credit, at the bottom there's a disclaimer. It says these are delicious cookies, but we make no medical you know,
have fun eating
claims
them,
based on that. So that's good.
And so I hate to say this, I don't know what the current approach to diabetes screening is. Has it changed over time? I imagine it has.
Well, no, there is a very specific approach which is recommended by the U.S. Task Force, and basically it says that if you are an adult, that you should get screened for diabetes, a blood test to screen for diabetes, if you are overweight or obese. And that's the problem, is because what we are now learning is that's not enough. We know that almost half of Americans have either diabetes or pre-diabetes, and huge numbers of them are getting missed. So a study just came out that looked specifically at this question, and what they found is that you need to get screened even if you're normal weight. And the reason is, it turns out that in white people, that weight qualification does make for good screening. But in the rest of the world, it doesn't. So particularly Asian Americans, it turns out a huge number of Asian Americans have prediabetes or diabetes, even if they are normal weight. So that's a problem with a lot of these recommendations, is that they're based on one group of people. So the bottom line take home from this is that if you are an adult, you should be screened for diabetes even if you are at normal weight.
Like at your yearly checkup?
At your yearly checkup. It's a blood test. And the value of this, of course, is if you pick it up early, that's going to save you from having you know, kidney problems, heart problems, eye problems. This is important.
All right. Well, you can check out Dr. Streicher on social media. Thanks again for being here.
Thank you.
Time now for Around Town.